Hi, I'm Patrick from the Salford Chiropractic Clinic, and today I want to talk to you about cervicogenic headaches. There's about 150 different types of headaches that have been listed, but today I want to talk to you about one specific type. They're called cervicogenic headaches. Now, that simply means that they're headaches that have their origin in the neck. Pain can come from different structures in the neck, whether they be the muscles, the nerves, or the joints. When these structures are particularly aggravated, the pain can spread into the head, and that's when we get a headache. It's often a referred pain from something else coming lower down. As chiropractors, we're trained to diagnose and treat these specific types of headaches using adjustments to free up the joint and techniques to help release the muscle. But how do you know if your headaches are cervicogenic in origin? There's two things that you may notice. The first thing is that your neck is particularly stiff or painful at the same time that these headaches originate. You may notice them first thing in the morning, especially if you're a tummy sleeper. This irritates the structures within the neck and crushes the joint, causing more irritation to the nerve. The second thing you might notice is that the headache gets worse when you push your head backwards to look up towards the ceiling. This is a similar motion as when you're lying on your front and sleeping. These headaches don't just have to be at the back of the head or the top of the neck. Quite often they'll extend into the head or come around the head like a common tension type headache. So how can you go about giving yourself a little bit of relief at home? An easy way to try and relieve some of the symptoms of the headache is by giving yourself a gentle massage, normally across the trapezius, so your shoulder, or right up into the top of the neck where it meets the skull. About 30 seconds of direct pressure with gentle movement can be enough to release the muscle and give you a little bit of relief. Also, we need to try and avoid things that are going to aggravate the headaches in the first place. As I said before, turning your head upwards tends to put more pressures on the structures within the neck. If you're a painter or a decorator and tend to do a lot of ceiling work, try and break this up throughout the day to avoid excess pressure on the neck. Also, if you're a tummy sleeper, you need to try and change this as quickly as possible. Lying on your side or lying on your back is much better for the neck. So, to recap, if you have headaches with a combination maybe of a stiff neck or neck pain, and you tend to notice that when you tilt your head upwards and apply a gentle pressure, these headaches seem to get worse, you may have cervicogenic headaches. Also, be wary of spending too much time looking up over your head and try not to sleep on your front if you are doing this already. Thanks for watching. If you found this information helpful, or if you think that there's someone that you may know that might find this information helpful, tag them below and ask us any questions in the comments.